If you are studying for the MCQE1 and you are not using the official 16-box blueprint, chances are that you are flying blind. Now, someone may ask, what is the official 16-box blueprint I am talking about? This is exactly what I mean. This one. If you're not using this table, no, you are flying blind. What do I mean by this? The MCCQE1 exam is not a random exam. It's an exam which has been mapped out step by step by step by step. And today, I am going to hand over this map to you so that you're going to use it and make sure that your preparation is thorough and is solid. Okay. Each of these 16 boxes represents the types of questions you will get in the MCQ1. And together, all these boxes come together to form the basis and the core of the Canadian healthcare system. By the way, I am Dr. Brony, the lead tutor at MedCognito, where we and our staff members, use group tutoring and data-driven teaching methodologies to help international medical graduates like yourself and Canadian medical graduates to pass the MCQE1 and other exams designed by the Medical Council of Canada with confidence. So what we're going to do is that we're going to walk through every box step by step, all 16 of them, see how questions are distributed, and also know the kinds of questions to expect and how many of these questions you are likely to see on the exam. So if you are ready, good, let's go. All right. So let's start with this. So I'm going to write the numbers so that when I mention the box, you know exactly what I'm talking about. So I'm going to label them from box 1 to box 16. Let's go. All right. So I have everything labeled here. So I have 1 all the way to 16. What do these mean? So now when I mention a particular box, you know exactly what I'm talking about. So let's start from box 1. But before we get to box 1, you realize that the whole exam is mapped as dimensions of care as well as physician activities. We have dimensions of care on the horizontal and then physician activities on the vertical. Under the dimensions of care, we have health promotion and illness prevention. We have acute care. We have chronic care, and we have psychosocial aspects of care. And on the vertical side, you realize that we have assessment and diagnosis, management, communication, professional behaviors. Now, if you look on the extreme side, you realize that they have listed the percentage of questions which are going to come from assessment and diagnosis, management, communication, and professional behaviors. And you also look down here, you realize that they've listed the percentage of cases which are going to come from health promotion and illness prevention. So that is 20 plus or minus 5% of the questions. Acute care, 35 plus or minus 5. Chronic care, 30 plus or minus 5% of the questions. And then psychosocial aspects of care, 15 plus or minus 5% of the questions. All right. But don't forget that the MCCQE1 has 230 questions in all. So if you are ready to go with me, let's start from box 1. In box 1, I call that finding problems early. Finding problems early. So in box 1, the kind of questions you're going to get there are questions which help you with, assessment and diagnosis of health-related issues. And it's also a connection between assessment and diagnosis plus health promotion and illness prevention. That is why I've entitled box 1 as finding problems early. So now the question you should ask yourself is, how many questions are you going to meet based on the distribution and the finding problems early? Finding problems early, expect about 20 to 22 questions. So that is when you have to start thinking about screening, okay? Which age are you going to do your pap tests? which age are you going to do your FIT test? That is the fecal immunochemical test, as well as risk assessments like cardiovascular disease risks, like cancer risks. And also, because we are talking about illness prevention, you should start thinking about immunization. So remember, this is where you're going to meet about 20 to 22 questions out of the 230 based on the distribution of questions. Okay, so what are you exactly going to study? Here, I want to draw your attention to the Canadian Task Force. Okay, Canadian Task Force on Prevention of Medical Conditions, as well as you also want to focus on age and gender-based screening, as well as asymptomatic risk assessment. So, what are the tactics you have to take if you want to deal with box 1, which is finding disease early? Number 1, know first visit counseling topics. For example, smoking cessation, and then understand who gets screened for pap test, FIT test, diabetes. When do they get screened and how do they get screened? So if you're excited about box 1, so we finished with box 1. That is why I've canceled it. Now, let's move on to box 2. Box 2 is a meeting of acute and assessment and diagnosis. So I'm going to mark that as one as done as well. So if you look at box 2, I have labeled it as what's wrong now. Because remember, it's acute now. Things are happening now. And if you look at the percentage of questions which are distributed according to the way the medical counselors labeled it, out of the 230 questions, you should expect 35 to 38 questions. So what's wrong now? You are literally thinking about acute medicine, emergency medicine, okay? So this is when you want to start thinking about objectives like approach to chest pain, objectives like sepsis, objectives like stroke, objectives like acute abdomen, where you can meet topics like appendicitis, objectives like, diabetic emergencies, pregnancy-related emergencies like ectopic pregnancy. So what's wrong now is what you're going to deal with in box 2. And the question is, what are you going to study? What you need to study in this box are things like, what's the most likely diagnosis? What are the red flags? Okay, what's wrong now? What's the next best investigation in this emergency? You also have to start thinking about time-sensitive diagnosis. And so what tactics will I use if I'm going into the exam and I'm focusing on topics which deal with what is wrong now? I'm going to master A, B, C, D, E, prioritization and acute setting, okay? Airway, breathing, circulation, disability, exposure, okay? Now, I also have to understand when to rule out emergencies before I can reassure patients. So we've dealt with box 1, we've dealt with box 2. Now let's go to box 3. Box 3, I call it figuring out long-term illness. Why? Because it's the meeting place of assessment and diagnosis and chronic conditions. That's what I'm saying, figuring out long-term conditions. And if you also look at the way questions are distributed in box 3, all right, you are looking at almost 30 to 32 questions based on the percentages the medical counselors allotted to this box, okay? And you are going to look at chronic conditions. So if you go into the objectives, look out for chronic conditions like diabetes, congestive heart failure, COPD, chronic kidney disease, hypertension. These are all objectives that you need to study. So what are you going to study so far as this particular box is concerned? You're going to study diagnostic criteria and staging of chronic conditions. How am I going to diagnose COPD? How am I going to diagnose congestive heart failure? How am I going to diagnose diabetes? Okay. What's the gold standard for COPD diagnosis? What's the gold standard for CKD? And then what are the stages of CKD? Stage 1, stage 2, all those things. And then as well as if you have a patient with a chronic medical condition, what investigations will you do to monitor that patient week in, week out, month in, month out, year in, year out? As well as you also want to learn how to detect complications of medical conditions. So if you pick a condition like diabetes, you're going to learn How does diabetic neuropathy present? How does diabetic nephropathy present? So if I'm taking the test, what will be my tactic? Know when to refer a patient and when to let the patient be managed by a primary care physician, as well as how to link diagnosis to long-term care outcomes. So we finished with box 1, box 2, box 3. Now let's go to box 4. Box 4, you realize it's a meeting of psychosocial aspects and assessment and diagnosis. So this one, I call it understanding mental and social issues. So this is also something you need to really master if you are going into the MCC exam. Now, based on the percentage of question distribution, I'm expecting you to meet about 15 to 16 questions. So this is where you're going to deal with topics like depression, anxiety, abuse, substance use, whether it's opioids or stimulants, cognitive decline, which we call dementia, okay? And so what are you going to study? You've got to study the diagnostic criteria, so the DSM-5 style for common mental health disorders. So that's where you hear people talk about acronyms like MCCQEs for diabetes, okay? And then where you use screening tools like PHQ-9 questionnaire, GAD-7 questionnaire, MMSE, as well as red flag symptoms of these mental health conditions. So how do you pick up red flags of a patient who is likely to commit suicide, suicide risk assessment, psychosis? So what would be my test taking skill? What would be my test taking skill? So far as this box is concerned, I'm going to learn how to practice empathy, how to also diagnose specific mental health conditions, and also learn, the various community supports which exist to help people with the various mental health conditions I've talked about. This is where I'm going to learn the difference between bipolar 1, bipolar 2, the difference between dementia and delirium, you see, and then which healthcare team members I should bring on board when I'm dealing with all these issues. So box 4, done. Let's go to box 5. So box 5 is what I call helping people stay healthy. Why do I say that? This is illness promotion and illness prevention, as well as management of that. So this is why I'm saying helping people stay healthy. And this one focuses on management and health promotion. And according to the distribution of questions out of the 230, in this box, I'm expecting you to meet about 16 questions. That is about 15 to 17 questions. So average 16. What are the topics I'm expecting you to, brush up on? Brush up on things like smoking cessation, obesity, which is a whole objective on its own, sexual health, lifestyle counseling. Okay, so what are you going to study so far as this is concerned? Vaccination schedules, okay, behavioral change models, lifestyle interventions like exercising, that's when you talk about the DASH diet, Mediterranean diet, so what are the MCC tactics you need to use? You will need to learn how to offer clear and doable management plans for patients who come with specific things where they want to learn how to stay healthy, as well as you also want to emphasize on prevention, even in chronic diseases. So that's when you want to encourage the hypertensive to cut down on salt, the diabetic to exercise, and to watch what they are eating, right? So box 5, done. Let's go to box 6. So box 6 is what I call fixing emergencies. Fixing emergencies. So don't forget, boxes is a meeting point between acute medicine and management. Fixing emergencies. How many questions am I expecting? If I'm looking at 100% of the questions, because we are looking at 100%, and that comes to 230 questions, I'm expecting about 28 questions averagely. So 27 to 29 questions on how to fix emergencies. How to fix emergencies. This is where you need to, learn things like your ACLS, that's advanced cardiac life support, your BLS, that's your basic life support, antibiotic prescription for patients with sepsis, asthma, COPD flare-up, hypertensive emergency. These are the kinds of things, if you look at the objectives very well, these are the kinds of topics you should be popping up for you. What are you going to study? What you need to learn is, your emergency drug protocols. So you have a patient with hyperkalemia. How are you going to manage? When am I going to admit a patient? When am I going to discharge a patient? So for something like pneumonia, KEP 65, right? Acute medication doses, for example, epinephrine for anaphylaxis, as well as how to use, insulin. How are you going to manage a patient with diabetic ketoacidosis? So what will be my tactic if I am going into the exam? I'm going to practice step-by-step management of patients with acute medical conditions, as well as I need to know which action comes next in the crisis. So if a patient comes with, for example, diabetic ketoacidosis, what am I going to go first? I'm going to give my fluids. I'm going to get my labs to make sure that the patient does not have low potassium. I'm going to check the potassium levels before I give my insulin. This is the step by step. That is where in acute medicine, you say, what's the next best step? What's the next best step? What's the next best step, right? So I hope you nailed that. So number 6, done. Now, let's go to number 7. Number 7 is a meeting point between chronic conditions and management. So this is what I say. I call box 7, managing long-term illnesses. Managing long-term illnesses. How many questions should you expect? Based on the way the questions have been set and have been distributed, I'm expecting about 23 to 25 questions. So averagely 24, where you are going to look at, okay, a patient has chronic medical conditions. How am I going to titrate their medications? How am I going to increase their medication doses? How am I going to cut down on the medications? Maybe if I'm over-treating that particular condition, what are the side effects of the medications I'm providing? What are the parameters I'm going to use to monitor this patient's chronic medical condition? So what are the things I'm going to study if I'm dealing with box 7? Number 1, guidelines for long-term control of medical conditions. So guidelines for long-term hypertension management, type 2 diabetes, hypertension management, as well as I'm going to learn the target goals. So if you have a patient with diabetes, what's the target blood pressure? What's the target HbA1c? What's the target LDL? Right? And what is my follow-up schedule for these patients? So what tactic am I going to use? I'm going to learn how to master continuity of care. Continuity of care. And I'm also going to balance, treatment algorithms with side effects of medications. So, box 7, nailed. Now, let's go to box 8. Box 8 is how to help patients with mental health conditions. So I label box 8 as helping with mental health. And with the distribution of questions out of the 230 and the percentages, I'm going to expect about 12 questions. That's 12 to 13. So this is where I'm going to look at how am I going to select mental health medications like SSRIs, like antipsychotics? When am I going to use first-line antipsychotics? When am I going to use second-line antipsychotics? When am I going to augment antipsychotic use? When am I going to change from a particular SSRI to a particular SSRI to another SSRI, or from SSRI to SNRI? And if I'm switching, how do I switch? When am I going to use a MAO inhibitor, for example? Okay, when am I going to use psychotherapy? When am I going to refer a patient to substance use programs? So what am I going to study in box 8? Initial therapy versus pharmacological interventions. So for example, a patient comes in with a particular mental health condition. Am I going to refer to CBT first? Am I going to do interpersonal therapy first? Am I going to do family therapy? Before I go into pharmacological treatment? What about harm reduction principles? So this is where I'm going to learn, my opioid use disorder, right? And how I'm going to manage a patient. I'm going to use methadone, Suboxone, Sublocade, and other medications we can give to support patients with For example, opioid use disorder, like clonidine, like metazapine for their sleep, like Tylenol, like Advil, like, all these other medications. And as well, crisis intervention plans. So I have a patient who is actively suicidal. What's my next best step? So what are my tactics for this particular box 8? I need to know mental health medications. I also need to know when I am not going to prescribe medications. And some unique medications, I need to know which labs will I do for those medications. And I also need to learn how to prioritize safety planning. So, box 8, nail. Now let's go to box 9. Box 9. So, box 9 is a measure between health promotion and illness prevention, as well as communication. So, I have called it explaining healthy choices. Explaining healthy choices, as well as communication and promotion. And I'm expecting, about 4 to 5 questions based on the way it's distributed. So the topics you need to cover will be prevention, counseling, vaccine hesitancy. So, if a patient has hesitancy about a particular vaccine because of what that patient thinks they've read somewhere, this is also where I'm going to talk about diet and exercise. So, what am I going to study in my MCQ1 preparation for box 9? Motivational interviewing, handling patient resistance to a particular public health and health promotion intervention. So what will be my MCC QE1 tactic? How to show respect to patients, how to offer options, how to stay patient-centered in my management. Now, let's go. So box 9, nailed. Now let's go to box 10. Box 10 is a merge between acute medicine and communication. So this is where I call it talking in emergencies. So you're going to be quizzed on that. You should expect it. Talking in emergencies. And based on the distribution of questions, I'm expecting about 8 questions. So this is where I'm going to learn things like informed consent, assuming there's no family member around. How to break bad news. What to do in a case where there's refusal of care. So what am I going to study? I'm going to study consent and capacity. I'm going to also learn about family-centered communication. That all comes under box 10. What are the tactics I'm going to use? I'm going to learn how to speak clearly, ethically, and urgently when needed. When do I contact family quickly? So box 10 is also nailed. Now let's go to box 11. Box 11 is still about communication, but this time it's about communication and chronic. So this is what I talk about, talking to long-term patients. So patients with long-term medical conditions, how to talk to them. And I'm expecting about 7 questions to come from here because of the distribution. If you look at the percentages on the X and the Y axis, okay? So this is where you're going to have conversations like adherence discussion, shared decision-making, long-term planning, okay? And what are you going to study? You're going to study empathetic negotiation with patients, as well as dealing with chronic pain. So this is where you have to be very sharp when you're dealing with patients with chronic pain. I'm also going to learn about fatigue management. So what will be an MCQ1 exam learning tactic? Show long-term support to patients with long-term conditions, and don't just learn facts, learn how to properly communicate with patients. Now, so box 11, done. Now let's go to box 12. Let's go to box 12. I'm really enjoying this. Okay, so let's go to box 12. So box 12 is a merge between communication and psychosocial aspects. So I call it discussing tough topics. Discussing tough topics. Now, from the distribution, I'm expecting about 3 to 4 questions. Okay, so this is where you have to learn disclosure of diagnosis. So somebody has a cancer diagnosis, somebody has HIV diagnosis. How do you disclose it? As well as suicide risk conversations, right? How are you going to have a conversation about suicide risk? So what are they going to study? Non-verbal cues, as well as cultural sensitivity in tough topics. In fact, The Medical Council has a whole course they've designed on their website about culturally informed care. I'll suggest that type that into Google and search for it. So what would be my MCC practice tactic for box 12? I'm going to practice being calm, affirming, and not judgmental when I'm dealing with patients and their concerns. So box 12, done. Now, let's go to box 13. So you realize that box 13 is a merge between health promotion and illness prevention, which goes with professional behaviors, right? That's box 13. Now, I've called box 13 doing the right thing for the public, right? Doing the right thing for the public because it is professional behaviors and health promotion and illness prevention. So how to do the right thing, that is the professional behaviors and health promotion and illness prevention comes to do with the public. So here you're dealing with issues of professionalism and health promotion. How many questions do you expect based on the percentage distribution? I'm expecting about 5 questions. This is where you are talking about duty to report, as well as public health ethical considerations, as well as vaccine mandates. So, what am I going to study? This is where I'm going to learn about legal boundaries, as well as confidentiality versus public health risks. So, you realize that as you learn, you realize that there are some topics or there are some medical conditions that are reportable to public health. It falls under box 13. That is professional behaviors and health promotion and illness prevention. All right. So if you are learning, what tactics should you have? Think like a team member and a citizen, where you want to protect the rest of the citizens, right? So when are you going to report? Are you going to report a patient who has HIV to public health? I think you should do that. Are you going to report a patient who has an STI to public health? Yes, you should do that. So box 13, done. So I'm going to cross that out as well. Now, let's go to box 14. Box 14 is a merge between professional behaviors and acute medical conditions. So this is what I call as being professional in emergencies. Being professional in emergencies, all right? Being professional in emergencies. So this is professionalism at play in an acute setting. How many questions should I expect? I'm going to look at the way they've distributed the questions. I'm going to expect about 8 questions, So this topic focuses on scope of practice, documentation errors, team leadership, right? So because in an acute setting, there can be errors. How do you document it and how do you communicate it? So what should the candidate study? What you should study is what to do when a colleague makes a mistake. Okay, ethical triage decisions. This is what you want to study. The tactic you are taking into the exam is how you are going to own your role in a group and how to escalate issues which need to be escalated appropriately. So point 14 or box 14, done. Let me cross that out. Now let's go to box 15. Box 15 is a merge between chronic medical conditions and professional behaviors. And this is what I call respecting choices in ongoing care. Respecting choices in ongoing care. So this one, you are looking at professionalism in the context of somebody with a chronic medical condition. Based on the distribution of questions, I'm expecting about 7 questions, okay? So topics like medical assistance in dying, patient autonomy, treatment refusal. These are the things I'm expecting in box 15. And so what am I going to study? Legal and ethical considerations in a particular patient, as well as surrogate decision making. So, what are the MCC tactics I'm going to use? You've got to learn respect and autonomy while ensuring understanding of the patient. So, box 15, done. Okay, so now let's go to the final and not the least box, which is a merge between professional behaviors as well as psychosocial aspects of healthcare. And this is what I call protecting privacy and boundaries. Protecting privacy and boundaries. So I'm expecting, based on the question distribution, okay, I'm expecting about 3 to 4 questions. So where you're looking at boundary violations. boundary violations, and confidentiality breaches. So you're looking at the issue of HIPAA, the issue of, relation between physicians and patients, right? So what am I going to study? What am I going to study? I'm going to study doctor-patient dynamics. I'm going to study mandatory reporting of, threats, abuse, child abuse, elderly abuse. When do you mandatorily report? When does the patient have to report? So the MCC tactic is how to protect the patient's dignity and safety always. So we've gone from box 1 all the way to box 16 done. So I'm going to make a big circle around everything, right? This is it. So this is what the exam is focused on. And that is why I said that this grade teaches you the foundation of the Canadian healthcare system. So now that we are done with box 1 to box 16, let's look at something. So in reality, this is all the MCQ1 is all about. We've gone through it box by box by box, from box 1, box 2, box 3, box 4, box 5, box 6, box 7, box 8, box 9, box 10, box 11, box 12, box 13, 14, 15, and 16. We've explained everything box by box. And you realize that everything under the MCCQE1 exam falls under one of these boxes. So all you need to do is to build your preparation around these intersections. If you do that, in reality, you are studying like a strategist, not as somebody who is just cramming medical information. And that is why at MedCognito, we want to make sure that you are doing things with understanding. So you realize that MedCognito gives you tools and mock exams tailored to each of these boxes, so you are never caught off guard. So before I end the video, I want to say this. Make sure you like, make sure you subscribe, and comment. I want to hear from you. Which box out of box 1 to box 16 are you most confident in with the way you study? Again, which box from box 1 to 16 worries you the most? What I want to say is this. As Dr. Bruni and MedCognito, we are here to support you. So let's support each other to the path of your medical licensing position so far as Canada is concerned. So thank you very much, and see you in the next video. All the best.